to welcome Aleksandra Kuzmanovic, who is the social media manager with the World Health Organization headquarters based in Geneva. You're very welcome to the show. Thank you for joining me.
Thank you for having me on your show. I'm really delighted to participate.
So I know you because your role is very high profile at the moment and we follow each other on Twitter, but can you tell viewers and listeners a little bit about your own background?
Thank you. So I'm a Serbian national, but I'm based in Geneva for over 7 years now, doing my master's degree in public policy and sustainable development, actually. And that brought me to WHO 5 years ago. I was working in the Department of Public Health and Environment. I was working on communications, but then 2 years ago, I moved to the Department of Communications, where I took over a role of a social media, one of social media managers in headquarters, and that's my current role that I'm enjoying very much.
So you're managing social media for probably the most high profile organization in the world right now. Are you feeling a new level of pressure and responsibility?
Definitely at the moment now with COVID-19, that all eyes are at us and what we are saying. But the level of responsibility before we press any button is the same, because the information we provide is about people's lives and it's about health. So if it's COVID or any other disease or health condition, we need to be 100% sure that this information is cleared and right before we send it out, because it's really, I'm passionate about health and I love my job, and it's great to have social media nowadays to inform public about what they can do to protect their health, and also what they need to know about new diseases or new treatments, etc. But on the other side, it's a huge responsibility behind every word that is in a tweet. Some people think, oh, it's just a tweet, but it's not just a tweet. Putting so much information into 1 or 2 lines in a tweet is a huge responsibility.
And it's also a skill, Aleksandra, let's be fair, it's a huge skill that is learned with experience. So how has COVID-19 changed your working day?
So definitely COVID seeks from us that we are 24/7 present, because it is present all around the world and we need to be present and relevant for every country and people anywhere in the world. The demand is high. Definitely then we are working 7 days a week in general, but this increased as well the need for us to be present on social media. Also, when outbreak happens, there's a lot of misinformation, and it's not something new that's happening with COVID-19, but it's the first outbreak of this size that it happens since social media evolved so much. So that puts more pressure for us to be fast with information or responding to rumors or misinformation, so that we can protect people and let them know what is the right way to protect themselves. So definitely it put more of a pressure, and luckily during this time we also managed to expand our team. We also expanded our presence to more social media platforms to reach as many people as possible with reliable and trusted information.
So let's talk about the social media platforms in particular. Which ones are proving very useful, and which ones have you expanded to?
So where we have our highest presence is Twitter, Facebook, LinkedIn, and Instagram. Definitely we are most active. I mean, platforms function differently, and therefore our strategy of how we use each platform is different, following the new developments on algorithms and platforms, but also our content, and learning by doing. Like, we are adjusting. Digital media is transforming every day. That way we also follow new trends and adjust our presence. But definitely we use Twitter for the wide range of audience, from general public to governments, media, policymakers, while on other channels our audience is mostly general public. So then as well depends which type of messaging we are posting on these platforms. Since the outbreak started, we expanded our presence on TikTok, Snapchat. We also launched for the first time a WhatsApp channel with a chatbot on COVID-19. We launched a Viber chatbot that we didn't have before. We launched as well Facebook Messenger chatbot. So these are all new products and a way of using social media that we've never done before. And this was all run by idea that we want to reach as many people as possible with reliable and trusted information in real time.
And of course, while people are in lockdown, their social media usage has increased. So in Italy, we saw that social media time spent was up by 70%. So this makes perfect sense that you're trying to reach people through all available channels. We know about social media influencers, right? And predominantly, maybe when you talk about a social media influencer, you might think about a blogger or an Instagrammer. But my eyes have firmly been on your Director General, Dr. Tedros, as being an influencer right now. How is he coping and responding to the attention from social media in particular?
I would say we are lucky to have a leader who understands the power of social media and the importance of social media in the 21st century. So he also, with his leadership and taking over the role as the Director General, he actually brought a new view to many people in the organization, not the social media team per se, but he brought with himself that that social media is important and we must use it better. So that really helped us to expand our presence, but also for other people to understand the importance of it. So he's not just external influencer when it comes to social media. He's an inspirational leader for many of us in the organization to use social media better, to explain WHO role, to explain what we do, and most importantly, to provide our recommendations to wider audiences than through traditional media. So definitely having leader as such helps. And he understands, and his appetite for social media is big. He uses his phone a lot. He's on top of everything. He's on top of information flow around him through social media or other digital platforms. So it's really good to have personality and leader as him in this pandemic.
And he is not the only person that is giving recognition and putting a value on social media communications. I was really pleased to see a tweet that you sent recently, which was a video clip of Dr. Mike Ryan, who is also from Ireland like myself, and he praised the silent heroes, being the World Health Organization media and social media team, and just pay tribute to your contribution to fighting COVID-19. How important was that shout out to you and your colleagues?
It really melted my heart listening to it, to be honest. I personally appreciate Dr. Mike Ryan very much as a WHO expert and one of our top leaders as well. And it really helps to have leadership that understands importance of communications in general and the role we are having, and as well they know how much time and efforts and work is there behind the scenes to communicate all the work that our experts are doing on the ground. So it's enabling factor for us to do all we want or need to do to communicate with people about this pandemic. And it's not always the case to have the leadership that understands importance of communication and still digital communication. It's not, especially in huge systems and bureaucratic systems like we are in a way, we have a lot of people who are very traditional, and they are great experts, and they stand behind the science in their fields. And I have all full respect for all of my colleagues. I've been learning so much being in this role of social media and then working with all different departments in the house and offices. But it would be harder if we had an expert who is leading the response but not understanding importance as well to communicate on what we are doing.
So apart from you leveraging the power of the social networks to communicate vital public health information around COVID-19. The social networks also play an important role. How have they been collaborating with you for public good?
Thank you for asking this. And I must say that our collaboration with social media companies, and broader than social media, other tech companies in this outbreak, has been amazing. We received a support more than ever. They've been working on, like, some of those companies, we already had established relationship and kind of collaboration. So when the outbreak started, it was just a natural transition starting, okay, what are we doing about this? And then we started with Facebook having, directing their users to WHO or national health authorities when people search for information. Then that evolved into a box popping in your feed as well to go to one of those resources. Then it moved to dedicated pages on social media, across social media platforms, where they collect the latest news from WHO, Ministry of Health, Public Health Institute, depending on the person's location. Now it goes to a wider range of products, of creative tools in the platforms for people to communicate, especially during this time when people are asked to stay at home. So it's coming from all platforms. We established, as I said, we were working already a lot with Facebook, with Twitter. Then we established our TikTok account, Snapchat. We strengthened our collaboration with LinkedIn, but as well with Tencent and Chinese social media platforms that are working very closely since the beginning with our country office in China. So this is not just in particular parts of the world, or just few platforms. It's really global effort, and companies, if we were not having relationship already or reaching out, they were reaching out to us and offering us help. So at some point I was also overwhelmed with, like, all offers coming my way, to manage all of these. And of course, in such moment, you don't want to miss any opportunity, because at the end of the day, you contribute to saving lives, and any opportunity you have to put your information, not your WHO's information, or reliable health information there, it's important. And we're also glad that companies are directing people to national institutes where they can receive information in their own language. We also expanded our efforts to translate information, but we do have limited capacities. And we also learned, not only in this outbreak, but we had some examples at the beginning, that some people had misunderstanding, lost in translation of some recommendation. So it's really important to be there in as many channels as possible, but also to provide information in as many languages as possible.
So you've been discussing digital communications, and as we know, it's broader than social media. What role has your website played in your communications?
So website is the face of the organization. We extract key messages from our documents and recommendations in different creative ways in social media to attract people's attention, and to simplify as well the information that they can take and apply immediately. But the website is the place where all our information is placed. And we also worked on creating more interesting and interactive pages, and that they are very prominent on our homepage. So when people search for information and come to the website, it's the first what they see is COVID-19, and then different sections, either for general public or for policymakers or for scientists or for health workers, because there's a lot of guidance that our colleagues prepare and publish every day for different group of responders.
Let's talk about press briefings, in particular the daily briefings that you are delivering to the media, but also to the public. You've embraced live streaming. Has this been a new development? I see you on LinkedIn, on Twitter, on Facebook. How is that strategy going?
So definitely live streaming, it's not new for us, but it's definitely new that we do it simultaneously on several platforms at the same time. We used to do some of these on Facebook and Twitter in parallel, but now we are doing them on LinkedIn. We will soon introduce them as well on TikTok. Some sessions we do on Instagram, not press briefings. Also, we are trying to do as many as possible, given the time availability of our experts, Q&As with our experts. That's the product that we have from before, but it's even important now for people to understand different aspects of the outbreak as well, and what different experts, which kind of advice they are providing to people to stay safe. So definitely in this pandemic, we expanded our presence through live stream and pressers, and to be honest, viewership is just growing. I was thinking that maybe through time it will go down, but it's just going up and up, and that proves as well that people are still hungry for reliable information and coming and following our press briefings, and what Dr. Tedros, Dr. Mike Ryan, and Maria Vankenkova, our key expert on coronaviruses, are saying every few days.
So what would you say is your single greatest challenge right now? And I do appreciate that you probably have many, but if there was one that was really challenging you or frustrating you right now, what would that be?
I think from my perspective is to respond to all demands and to all the opportunities that we are having with digital platforms. I mean, this is like you have all different platforms, partners, ideas open for you there. But the day is too short to utilize them all properly. So it's still my challenge how best to use all of these resources, again, with the aim to deliver reliable information to as many people as possible.
So a question that will definitely help your colleagues in government and public sector communications, apart from the social networks themselves and using them natively, what software, tool, or app is really helping you right now in your work?
Oh, so there are different tools, and I would say as well, what helped me a lot is besides some digital tools and, for example, social bakers that we are using for monitoring, there is also CrowdTangle that we have, and that Facebook colleagues also helped us build some dashboards for us to save us some time. I think as well, continuous communication with people working for these companies, I find the most helpful, and I'm using this opportunity to say thank you to colleagues in Facebook, Twitter, Snapchat, Pinterest, LinkedIn, TikTok, Tencent, and others for continuous conversations on weekly basis, providing us with suggestions, feedback, and also like doing some work for us, because it really helps to have partners in this time. And also my colleagues in regional office and country office, and the whole team in HQ and the whole organization. It's really a team effort. There's no single social media, WHO social media post that is just one person behind it. There is a whole chain of scientists who are working sometimes for years to provide us with information. Then there are other communications colleagues who are packaging this information, and then it comes to us when we repackage it for social media, and we have different creative colleagues or designers who help us to present this, and our audiovisual team producing videos for us. So it's really team effort, and I'm using now the opportunity to express my thanks for the partners, but also for all my colleagues in-house.
And I'm sure they will all very much appreciate you saying thank you. There are the main viewers of this show and listeners are your peers who are working in public sector communications, and each of them have their own challenges, and each of them are playing their part to save lives in the fight against COVID-19. What piece of advice or solace can you give them right now?
Number one, listen to your audience. Things that work for maybe for WHO don't work on your channels. And we see that across different WHO channels. What works for us on HQ headquarters communicating on global level, it's not necessarily the best tactic for one of our regional offices or country offices, because the audience is different. So I think the number one is whichever platform you're using, and it's the number one is listen to your audience. What do they want to hear, and or in which way they are consuming the information the best. So if you understand your audience and how they think, that's the number one recipe for success in my opinion. And then it goes creativity, and then it goes thinking outside the box, how you can challenge them, how you can stick out from others in the news feed. And to be honest, we are providing serious information. We are all serious organizations, and when you go through the news feed, you see plenty of people on your friends' photos from holidays, from children's birthday, or delicious food. So it's a lot of creatives that all of us prefer to see rather than to read serious content. So it's a harder challenge for us. And we also have, in the public sector, we don't have resources for marketing agencies, and so we need really to think hard how to get attention for our content and information.
I have one final question for you. How are you minding yourself, your own mental health and well-being? You're working 7 days a week. There's no immediate respite on the horizon for you in terms of, you know, a vaccine or COVID-19 disappearing. So what are you doing to mind you?
I love my job. That's the first thing. And our mission is to keep the world safe, promote health, keep the world safe, and serve the vulnerable. And that definitely drives me every morning and late night with my job, is that the world needs us now. But what I do is I do follow our recommendations when I walk to the office and I walk back home from the office. When I have some time over the weekend, I love rollerblading. So that's 1 or 2 hours for my mental health more than for my physical health, but it helps both. So yes, I do my best as well to find some time for myself during the week.
Aleksandra, thank you so much for sharing your insights and being so honest with all of us. I really appreciate your time. It's something that you don't have a lot of, but I think the value of this interview and this conversation will extend worldwide, and people will certainly take solace from how you are managing COVID-19 in a communications role. So thank you so much.
Thank you so much. And I really hope that for my colleagues watching this as well, that they will use social media as much as possible to help us deliver information that people need from us more than ever. Thank you for inviting me.
Thank you.